Welcome back. Now, in this video, we are just going to discuss the basic concepts of camera head in minimal access surgery. Just to remind you regarding this video, it is a part of the imaging system that is used in minimal access surgery we are discussing. We have already discussed the telescope, followed by we have discussed the light cables. And in the third video in this series, we have discussed the light sources available. And this is the fourth video in this series where we are discussing the camera. The camera head and the camera source or analyzer, these two things are different things. This camera head is attached with the telescope, and through this camera head, the signals are going towards the camera analyzer or the camera source, and through that camera source or camera analyzer, the monitor is attached. So in this video, we are just focusing over this camera head, right? Now this camera head, basically it has two parts. Just focus on the alphabet C, again C, and again C. So camera head, two parts. Starting with C, that is coupler, and the CCD. CCD stands for charged coupled devices, right? And coupler, another part of this camera head. Just to revise it, the imaging system what we have discussed till now is telescope. It is attached to the camera head, and this camera head is having two parts. The C stands for coupler and CCD, charged coupled device. Here, this is the shaft of telescope. This is the light adapter. This is the light cable. And here some more light source we have already discussed. This is the eyepiece, and with the eyepiece, the attached is the camera head, and this one is what is known as camera head, having two parts, the coupler and followed by CCD. Now here you can see the coupler is lying in between CCD and telescope assembly. Clear? So in this video, we will focus on this coupler as well as this CCD. Before discussing the coupler and CCD, I would like to just remember this slide and just correlate it with the human eye mechanism. Suppose this is our human eyeball. Okay, let's consider it as the right eyeball of a human being. Now here, I'm dividing it just at the level of the presence of lens. Suppose here is the ocular lens, the natural ocular lens that is present inside any human eye, right? Behind this lens, this is the second zone, and this one is the first zone, just for understanding the concept, right? Here we are having this line, this is the cornea, clear? Then here is the lens. Somewhat here there is the pupil and iris, right? This area is pupil. So light is coming, then again traveling through the pupil, then lenses, and again that is being converged and forming an image over the retina. And suppose this layer is the retina, right? Take it like this, the various, suppose image is forming here at the retina. Clear? So this first zone is basically copular in our camera head, and the second zone is CCD in our camera head. Almost similar, right? What does it mean, almost similar? If we are going to remove, let's say, the cornea, the pupil, as well as the lens system from any human eye, I don't think we can see the things with the help of retina directly, no. But yes, if retina is intact and functional, even if this lens is not present, cornea is not present, even then we can have the perception of light. Agree? Yes, I know you're answering yes. So perception of light is preserved even if we are just taking out the lens up to the lens part. Why? Because retina is healthy. So here the same thing applies to CCD. Even if we are just detaching the cupula from the CCD and just focusing it over the front area, the CCD will perceive the light over the monitor, but there will be no image, right? So by this description, we know that this coupler has another function as focusing. Focusing the image, it focuses the image over the retina, means over the CCD. So one of the function of this coupler is focusing of image over the CCD. And the first function you already know, that this coupler attaches telescope with the CCD and it is present in between the CCD and telescope. So let's start with the camera head. Two parts, coupler and CCD. Coupler, the function of coupler is to couple the telescope with CCD. CCD is charged couple device. This coupler has two lenses, one for each side, one distal and one at proximal. And these two lenses, they are used to focus the image on CCD. So whenever we are using the telescope assembly along with camera head, you must have observed this consultant is saying just focus the image. So here is the function of this coupler. It is used to focus the image. That round wheel that is usually present at the proximal end of telescope when the camera head is attached to it, that coupler, it focuses the image on CCD. So it is almost similar to the cornea, pupil and lens of the camera I have just explained. And that's why this coupler has two functions. It attaches the telescope with the CCD of camera and it focuses the image over the CCD for further interpretation. Now next important part of camera head is CCD. It has a slightly green, visible as a green chip inside, like we are having a retina inside our eye, and it is almost similar to the retina of eye, the CCD. And that's why I have just explained it to all of you that only after attaching the CCD with coupler we can see. Means that camera can see, right? This CCD is basically there are two types, the single chip CCD and the three chip CCD. This is also known as single chip camera and the three chip camera. This single chip camera can be used for diagnostic purposes. The procedures requiring less time. right? And I agree, when the single chip camera was the only camera that was available, this was used everywhere for laparoscopic cholecystectomy, for laparoscopic appendectomy, and other minimal access surgeries. But after the availability of 3-chip CCD or 3-chip camera, now the use of single chip CCD or single chip camera is only limited to the diagnostic purposes. And why limited to diagnostic purpose? Because we are already having it. I am not recommending the single chip camera that yes, go and buy it and use it. No, nowadays the best choice is the 3-chip camera. And if we are having the 3-chip camera, this 3-chip camera can be used anywhere in advanced laparoscopy as well as in simple procedures like diagnostic laparoscopy. So in any manner, this 3-chip is better. If you don't have a single chip camera and you are planning to buy any imaging for minimal access surgery, always go for 3-chip CCD or 3-chip camera. Why it is important? How it is helpful to have a 3-chip camera? This 3-chip camera is nothing to do with resolution, image resolution, nothing to do with resolution part. So one of the MCQs could be there. Yes, this 3-chip camera is everything to do with the color of the image. As you already know, minimal access surgery is image over the surgery over the image, the minimal access surgery. This is how it is different from open surgery. Open surgery, you are directly operating the organs, and here you are just doing the surgery over the image. You are looking at the monitor and you are just operating it. So 3-chip means better color, right? Just remember, 3-chip color, only color. 3 means third alphabet, and this color again start with C, the color, third alphabet. Don't get confused with the resolution. Resolution is basically a function of the monitor, the high standard or the high definition or standard definition, the monitors, the digital analog monitors. The resolution is important there. Here the 3-chip is for color. For better color, 3-chip is important. In single chip, all the 3 primary colors, the red, green and blue, they go via one chip. And that's why they just disturb each other. They make a noise. Why? Because single channel is there. And in this single channel, if you remember the Vibgyor concept, the visible spectrum of light, here R stands for red. And red is having the largest wavelength, right? Largest wavelength with least frequency. And that's why we can say yes, red is an obese color. And if there is a channel through which the colors are supposed to go, the red will block all other colors behind it. And that's why it dominates other colors. So in front of red, if the red color is there, all the colors fade and disappear. And everything will start looking reddish. And where is the clinical situation where we are going to have red inside any patient? Yes, right? Whenever there is bleeding inside. So the take-home message is, whenever we are operating and in everything, if that is going fine, there is no bleeding, even the single chip camera is better. But if yes, it starts bleeding, the best option that should be used is 3-chip camera, right? In 3-chip camera, all the colors, they appear. As here you can see, in minimal access surgery, if single chip we are using, it is very difficult to see anything when bleeding starts in single chip. Whereas and in that single chip the red color will not show. The red color will show its dominant nature, whereas in 3 chip red color will not show its dominant nature. Why? Because there are 3 chips and one chip is reserved for red, one chip is reserved for green, and the third chip is reserved for blue, RGB. Right? So if the 3 chips, they are reserved for different colors, very good image, very colorful, the natural color we will get inside. So just remember the 3 chip camera, there are 3 chips or 3 charge coupled devices are there, and they're separately sending the signals further, so there is less noise and better color of the image, right? So what is the function of CCD? It perceives the color of image and it sends it to the camera analyzer that is attached behind, and that camera analyzer or camera body or camera source, it projects the image towards the monitor. So after discussing this coupler and CCD, there are other functions of camera assembly that is available. In the next video we will discuss it, like what is the concept of white balancing and focusing, the shutter speed or the fibroscope filters and other parameters. In the next session we'll discuss it. Right? Thank you.